This is the treatment process for early-stage dental cavities. First, the dentist applies a separating agent to the grooves of the tooth to make it easier to remove the mold later. Then, they fill it with resin to take a precise mold of the tooth's biting surface. After curing it with a blue light, the mold is removed and set aside for later use. Next, a high-speed handpiece is used to remove the decayed parts of the tooth, those black lines. You see, since the infection is still in the early stages and only on the surface, no anesthesia is required. Once cleaned, it's time for filling and restoration. This green liquid is an acidic substance that etches tiny pores into the tooth, ensuring the filling sticks securely. Next, an adhesive is applied to the edges and interior of the cavity, followed by another round of light curing to prep for the final resin. Once the cavity is filled, a thin film is placed over it. The mold taken earlier is then pressed onto the resin to create an imprint. Once the cavity is filled, a thin film is placed over it. The mold taken earlier is then pressed onto the resin to create an imprint. Once the cavity is filled, a thin film is placed over it. The mold taken earlier is then pressed onto the resin to create an imprint. But here's an important note. Not every dark line in your tooth's grooves means you have a cavity. For most people, those fine lines are actually just stains from food pigments that have built up over time. For more videos like this, please like and subscribe.